Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to another edition of Hilaal Live. My name is Luqman Shadrack, all the way from the Cape Town studios. Thanks for watching us. I trust you all had a great weekend. We had some lovely rain in the Cape area. Other parts of the country did rain a bit as well, so I hope you were safe. So on a Monday, we like to invite people that do remarkable work in and around our communities. And more recently, and very prevalent these days, is the rise of diabetes. And I thought, let's invite Dr. Omar Omar into studio to chat a bit more about that. Assalamu alaikum, Doc, and welcome.
Wa alaikum assalam. Thank you for having me. I appreciate it.
My absolute pleasure.
Thanks for the invitation.
As I said, look, diabetes, it's, we can sort of count on one hand how many people in our vicinity, in our community, our family, our colleagues that have been diagnosed with diabetes. It's on the rise. For one would think with so many years of research experience that there'd be a lot more awareness around diabetes. What's your take? I mean, being in the medical industry, do you find that a lot more people are being diagnosed with diabetes?
Definitely. Look, I've graduated more than 20 years ago. I won't put the date to it, like pre-2000. And the trend has been, in South Africa specifically, quite an increase in diabetes. We above the world average. The world average is under 10% of the population. And we've gone up from 9 to almost 13% in the last 10 years. So prevalence is higher than the world average. And the trend is that it's an increasing trend of diabetes, which is not a good thing.
Of course.
So the trajectory might be even higher in 10 or 20 years' time.
Of course.
So we need to look at it quite seriously as a country and as a community.
Right. What are some of the various forms of diabetes? I know it's categorized in various stages. For our viewers that would like to know a bit more, what are the various stages?
So diabetes is categorized as type 1 diabetes, there's type 2, there's even the type 3.
Okay.
And then there's a few other types of diabetes that's very uncommon, but they do exist. So your type 1 would be an autoimmune disease where your body attacks your pancreas, your immune system, and that usually the diagnosis occurs much younger. As the immune system gets stronger and more mature, it starts attacking the pancreas and you get type 1 diabetes.
Right.
So those patients need insulin from a very young age, usually. It can happen later on in life, but it could be a child or a teenager.
And the type 1, can that be, being, from generation to generation? Is it?
Yeah, there's definitely a genetic component to all of them.
Okay.
There's a little joke that's often used in medicine. You can't choose your genetics. You can't choose your parents. So there's some things that's not modifiable. Your genes, your age, your race, that's always going to be there. So there's a predisposed risk for you if you fall into one of those categories. And as we get older, that's when type 2 diabetes becomes more prevalent. And that's more where your pancreas stops making insulin or makes less insulin than required, or the insulin in your body, there's a resistance to it. So maybe we can just step back. Diabetes means that your sugar levels or your glucose levels are high.
Right.
And in our body, glucose needs a destination, needs to go somewhere. So you have a glass of Coke or whatever, sister, and your body digests that, and it breaks the sugars down into glucose, and then the glucose needs to go somewhere.
Right.
And so insulin is like its escort. It takes it where it needs to go, either to your muscle or your liver or in your bloodstream or the organs that need it. And if your sugar levels go up and insulin's not there, it just hangs around in your blood, doesn't know where to go.
Right.
So that's what causes the damage. Much like sugar could damage your teeth, internally it's going to damage your organs.
Right.
So type 2 diabetes, your insulin levels start to decrease. Type 1, you can't produce it. Type 2, you're producing it, but there's less of it, or there's a resistance to it. In a sense, that's type 2. And you mentioned there's more than one. The third type, there's a type 3, very rare, so it's nothing to worry about.
Okay.
And then often pregnant women also get diabetes.
Yes.
So that's
I've heard of
your
that.
Gestational diabetes.
Right.
And it's similar to type 2
when
they're pregnant. And that's because the placenta is producing hormones that cause an insulin resistance in the body. But it is a clue to that there's a better chance of getting diabetes type 2 when you get older, as for the lady that's pregnant.
So
So
that's
it's
a
a
bit of a
early
warning.
warning sign,
Yeah,
yeah. So,
right.
but it doesn't mean if you didn't have it in your pregnancy that you can't get it later on.
Yeah. So I would imagine, so having diabetes, it then causes a ripple effect into your body.
Right.
And what are some of the causes that that may happen?
So if you think about the blood as a fluid, like water, and I think the ladies in the audience will agree, if they keep adding sugar to water, they make a syrup. It gets sticky and thicker, and that's essentially how you should think about it. So as the levels go up, your blood gets a bit sludgy, your leukocytes, your white blood cells become a bit lazy. They get drunk, almost drunk on the sugar.
Sure.
And your end organs, and I'll tell you what those are, would be your eyes, your brain, your kidneys, the tips of your toes, all the small arteries around your heart. Those small arteries, you're going to get decreased or poor perfusion or slower blood flow. And that's how people end up with kidney damage, retinal damage, brain damage. They lose their toes because there's no blood flow. So that's really where the trouble starts, the end organs.
The chances of this happening is, I would imagine, is really high if one doesn't control their diet, control various parts of medication that's needed, and also checkups to the doctor as well. What is your advice to diabetic patients that need to have all those things in place?
So diabetic patients need to get a couple of things like straight from the get-go. They must check they need their sugar controlled every day. They need to see a healthcare provider regularly, whether that's 6 monthly or annually, what they can afford. But there's a lot of access to healthcare. Checking your sugar, you can just buy a machine. It's like 200 Rand. I don't know what it is in dollars, but it's not a lot of money. It's just to look after yourself.
Of course.
And then it's imperative that they see a dietitian. Doctors are not dietitians. We don't spend 4 years studying diet and dietary advice. We understand it, but we're not the experts. So it's a real investment in your health if you go see a dietitian. And I would say it's as important as seeing your doctor if you're diabetic. And then your question was
in terms of the the various the risks that could happen if you don't manage your health, manage your medication and your checkups as well.
Right. So if it needs to be a daily awareness and a daily awareness on your medicines and your health, like so hence the checking your sugar at home, taking your medicines daily, and the dietitian will just kind of keep you in the narrow as far as your diet's concerned. And then another important part, I think we're going to get to it, but it's just looking at your weight and exercising. There are lifestyle changes that can improve your daily sugar levels.
Gotcha.
And sugar is a bit of a woodpecker effect. You know, a woodpecker is a tiny little bird, will make a big hole in a strong tree, and you and I can't punch or scratch a hole into it. But it's that constant damage that causes the damage in the blood.
And if you're obviously not diagnosed properly, not treated properly, it's going to exacerbate the situation as well. Do you find that when patients come to yourself as a doctor, they're looking for that holistic approach? And you mentioned, a dietitian. You mentioned, and I would imagine other professionals that needed to be added on. Should if the person can afford it, number one. Number two, also the extent of their diabetes as well. And you would need certain, like a podiatrist for that matter, to manage their feet. Yeah,
so again, there are lots of auxiliary medical care and facilities that's important. So podiatrist looking at their feet, the dietitian, exercise person, maybe somebody at the gym, personal trainer, seeing the GP. Include the pharmacist not in the treatment, but like can guide them with get your sugar strips, or we're having a day where we're doing free checkups, that kind of thing. In the long run, yes. So as practitioners, we need to monitor the extent of the disease and the blood tests that we do for that, and we check your kidneys, and you should also have your eyes tested once a year. It's a lot of work for the patient, but you don't want to lose your eyesight or your toes or your kidneys.
Exactly. And age obviously can speed up things as well in terms of if there's an underlying diagnosis that needs to happen. Age contributes towards that as well.
Yeah, we notice as the likelihood of picking up a diagnosis does increase as one gets older. Also, we need to talk about other diagnoses that complicate diabetes, or that diabetes would complicate as well, which is where your visit to your doctor once or twice a year is very important for that checkup.
Okay. I suppose we all have this worrying question in our, somewhere in the back of our brain. Somebody in our family's got diabetes. Will I get it? So what should I be doing, knowing that there could be a possibility that could be genetically passed on to myself? What should I keep in mind, knowing that?
Look, if that's the situation you find yourself in, you can't choose your genes or your parents, go to your doctor once a year at least, or pop in at the pharmacy and say, check my sugar. Even if it's when you're in the mall, we all go shopping, there's a pharmacy in every mall. You can pop in and just get your sugar checked. It's simple, it's not an expensive thing, it's not painful, it takes 10 seconds. So that would be a good screening test. And wherever you have it done, they should tell you, look, this is worrying, go see your doctor. Or no, it's fine, And
I think we also need to be realistic in terms of what we eat, what we put into our body, the output in terms of exercising, and how that's going to reduce certain other ailments that could possibly creep up as you get older.
Right, absolutely. So if we're going to move on to exercise, I was talking about like insulin resistance. When you exercise, and the key figure they say is about 5 times a week, minimum of 30 minutes. So you don't have to do 6-7 hours every day. But if you do 5 times a week, 30 to 45 minutes, what that does is exercise increases your sensitivity to insulin. And it also burns up some sugar, and it creates space in all your muscles to absorb some of the sugar that's being stored there. So that's where exercise comes in, and then the weight loss, of course.
Of course. We're going to take a short ad break very quickly. When we come back, we chat a bit more to Dr. Omar Omar about a very worrying topic in our community, diabetes. And I'm sure that you're paying close attention to this topic as well. Thanks for watching us on Channel 347 on DSTV. Assalamu alaikum. Shukran so much for joining us on Hilaal TV, Hilaal Live. Until about 6:30, we take a break from 2:45 until 6 o'clock and then resume again. Interesting topic today on diabetes, and I'm sure you, our viewer, are paying close attention to some of the important messages and information that's given to us by our esteemed guest in studio, Dr. Omar. Thanks so much for joining us. We really, really appreciate it.
Oh, you're very welcome. It's an honor to be here.
Shukran. So, chatting about this topic of diabetes, I'm sure, I don't know if you feel, but I can, people come to mind that that have succumbed to diabetes, or just find it very difficult to manage some of their symptoms. And it's always a topic that we know 3-4 people at the tip of a finger that have been diagnosed with diabetes, have not treated their diabetic symptoms properly as well. When someone comes to you and you say, you know what, I need to do your bloods, you do your bloods, you get the test results back, and you say, okay, look, I've got news for you, you're diabetic. All right. What are the first bit of advice you would give them? Take us through that process. Because right there is where the worrying factor starts. Managing it I would imagine, gets a bit easier. But that initial stages of where somebody, say, in their 30s or 40s now being diagnosed as diabetic, what's the process you would take your patient through?
So look, normally it's a big shock to the system if they don't anticipate it. Sometimes it's a big surprise, and sometimes they come saying, Doc, I think my sugar's up because I know the symptoms from my mom, dad, brother, sister. But at the outset, one needs to just say, look, this in your mind, this needs to be permanent.
Right.
Don't ignore it. Don't be like an ostrich and put your head in the ground. We can manage this together, and you can live a normal life just like anybody else, but you need to take the bull by the horns from today and understand that it's quite serious if you don't,
Correct.
And then I go through a discussion about medication, lifestyle, diet, long-term, just looking at the patient holistically, and potential complications if we don't do things correct today, because we're managing outcomes. In a sense, we're managing what's going to happen in 10, if it's a 30-year-old, 20, 30, 40, 50 years time. And that's a long run to go from 30 to 80 without managing it well up front.
Correct.
So, and it is a snowball effect, where if you don't manage it well early, you complicate things later on. And once the complications arrive, they're very difficult to deal with.
But also, it's getting your loved ones involved.
Right.
In that process as well. I would imagine, because if you have a partner system, it becomes easier. Because like you said, it's initial shock to the system that now I've got to live with diabetes. And, back in the day, it was under-researched and, we didn't have too much information. Now we've got a wealth of information that each individual needs to source that information and deal with it and implement it in their lives. But having the family, having your loved ones involved, that would make things a bit easier.
It does, and there's a flip side to this thing. The family involved, they need to support them, and they need to come on board. Sometimes it might be a dad, wife, and there's a couple of kids, and it's a big nuclear family. And now one person has diabetes. Now the cooking should change for everybody.
Correct.
You can't make a special meal for dad or for mom or for the one child, and it's difficult if you're going to be serving cake and desserts and trifle and kusistas on a Sunday when mom or dad or one of the siblings can't have. So there's a sacrifice from that side. The flip side is you got to understand some patients make excuses for their partners. Or you ask don't tell doctor about the cake, that kind of thing.
Cheat day,
that's the thing. There's no treat day, no cheat day, it's a little bit of sugar. It's diabetes.
It's a lifestyle change.
And I hear this all the time. Here's a little bit of sugar. It's like being a little bit pregnant.
Right.
you have diabetes, and not to underplay that,
I get that. Yeah, it's a complete lifestyle change. I mean, and even if you pre-diabetic as well, type of thing, you should start taking care of that as well. However, when it comes to a topic like diabetes, there's a lot of misperceptions out there around this topic. And there's a lot of myths out there. Dr. Google is also can be misinformative in terms of if you don't research and read the topic right. And read the information right. Because you're a diabetic patient, I'm a diabetic patient, but the rules may differ slightly, according to how we treat or how our symptoms present itself as well. What are some of those misperceptions?
Okay, so one of the things is I just want to start with the phrase called the silent killer. That's what doctors call it, the silent killer. So often there aren't symptoms and you feel good. Sometimes your sugar is a bit high, you feel better than when it's normal because the sugar levels, you get that sugar rush. So it's a silent killer. But back to your question, the misconceptions. One is you don't have to have symptoms to have bad diabetes.
Okay.
That's important to know. You may feel good, but you're not in a good state.
Right.
The other big misconception is the diet and the cheat day, like we spoke about, or the occasional treat. Because if it's once a week, it's still 15% of the week your sugar levels are up, and if it carries over into the next day, it's 2 out of 7. It's 30% of your week your sugars are up. So that one slice of cake, there's no cheat day. That's a big misconception. Then there's this concept of eating healthy. People will assume I'm going to steam my food and that's going to make my sugar better, or I'll eat brown sugar instead of white sugar. There is a difference, but it's still sugar. At the end of the day, the total sugar in your body is the same. So there's a lot of misconceptions around diet, and then also a lot of misconceptions about how your sugar levels are going to affect your, I hope it's okay to say on this, other body functions. So there's an effect on, there's depression. We don't talk about it often in our communities. There's sexual dysfunction. It's all related to your diabetes. And then also the side effects of the tablets. There's a misconception that if I take my tablet, I'm going to be fine. Or, you know what I mean? I don't have to see the doctor. So there's a lot to talk about. I mean,
it's so
focus
vital
me on where you want me to talk about.
Exactly, but it's so vital that your treatment needs to be addressed all the time. Your symptoms need to be addressed all the time. So it's a constant, taking stock of where you are with your diabetes. It's not a life sentence, though. That's what people should understand. It doesn't have to be, correct. What are some of the main challenges, or maybe the lifestyle barriers that we currently face in society? I mean,
Right.
you mentioned earlier that we have a lot of obese people
Right.
as well in South Africa. That's been on the incline.
Mm-hmm.
Are there other barriers that seems to be standing in the way of getting that message of diabetes out, and how important it is to actually, you know, just take stock of your life and watch certain things that you do?
Absolutely. So let's just talk about exercise as an example. I said 30 minutes 5 times a week. It sounds easy. It doesn't
Right.
sound like a lot, and
I think it's
but
more
it's
mind
hard
of-
for a lot of people. It's hard
mind
for a
over
lot of
matter,
people.
yeah.
Just getting started is hard, and depends where you live. You know, there's certain areas you can't just go for a stroll in the
Sure.
afternoon on your own.
Yeah.
You know, there's South Africa. There's
Yeah,
a
there's a risk.
security risk as
Correct.
well, and then some people work hard. You know, people get up early, use public transport, come home in the dark. Now have to cook for the kids and do homework. So to ask somebody that works 5-6 days a week
Yeah.
to find 30 minutes 5 times a week to exercise in daylight hours, it's not easy.
You're going to get some
So-
very famous Cape Town phrases if, you know,
Yes, yes.
asking someone to do that, because, you know, their mind and body is consumed by their work
Yeah.
environment.
So there are challenges that everybody faces, and it's also not easy to institute these changes dietary. It's also expensive to eat well for people.
Exactly.
The cheap foods are filled with sugar.
I saw something, I think that was a small group of fries at one of the famous outlets, and that was like, say, 5 rand or 6 rand or
Right.
something like that, and a big fruit salad type of
Right.
thing was like 10 bucks, you
Yes.
know, and that's the way we're working with, and unfortunately we've run out of time.
Okay.
I'd love to invite you back next week.
I'd love to.
You know, to chat about some other pertinent issues that plagued our community as well. We want to say thank you so much for coming into the studio and sharing your valuable time as well.
Once again, you're very welcome, and it's an honor for me. I hope I did you justice.
Absolutely, absolutely. Jazakallah so much. Have a great evening. Assalamu alaikum.
Salam. Thank you.
And that's Dr. Omar Omar coming in on a Monday to share some very valuable information around diabetes today. Next week, we'll bring another topic, inshallah. Next year, I'll open up the WhatsApp line if you'd like to communicate and maybe message Doctor while he's in studio. Coming up after the break, we chat about an initiative that the Claremont and Newlands community are setting about. It's remembering a very special time in our history as well. You are still watching Hilaal Live.